The need for mental health services has increased dramatically over the last 5 to 10 years. Individuals are more comfortable seeking care, which is a wonderful thing. However, the demand has exceeded the workforce capability. What we're needing to do is find those solutions that broaden that reach.
You go here for physical health and there for mental health, but the truth is we show up as humans and we just need people to guide us to care. I think we still have a crisis around that and trying to ensure that we have affordable, high-quality care for folks when they need it. CVS has such an amazing platform because we're in the community and can deliver care.
CVS has a footprint and it has capabilities that no other healthcare company in the country has. So within Aetna, we do behavioral health care management. Within Oak Street, we do the integrated collaborative care model. Within Minute Clinic, we provide specific specialty behavioral health services for mild to moderate illness. And having that footprint along with the various capabilities that we have under the CVS umbrella gives us an opportunity to be at scale with all of these things that we know really improve people's health and their outcome and their quality of life. Minute Clinic has been a special project for me. It started off as, a very small pilot where we were building out a few locations in a few geographies. At this point, we are able to cover the entire country with our virtual care.
We offer mental health counseling services in 49 states plus DC. We do that both in a brick and mortar capacity in a subset of states, but majority of our visits are virtual. When we started this journey, we knew that there really isn't healthcare without mental health. You see CVS or Minute Clinic, you may have been coming in for a flu vaccine and you see, gosh, did you know we do mental health? And that trust really starts to integrate and blend. And our goal is to then surround them with the right provider and care team. And we believe Minute Clinic can do that.
So when patients first come to us, we conduct a mental health assessment. We talk about what their goals are for therapy, and depending on the severity of their symptoms, we determine whether or not they're appropriate for our level of care, which is non-intensive outpatient.
When somebody has a psychotic disorder, bipolar disorder, extensive comorbid substance use disorder, we have referral pathways to get them to a partner that's going to provide that more intensive subspecialty care.
Over 80%, tell us that their symptoms are declining, they're getting better. That's such an incredible thing to be able to say out loud, because that's ultimately what we're here for, is to help people live their best life and have well-being.
Your older population, they tend to have multiple things going on. Within that integrated collaborative care model, it allows that primary care clinic to also screen for mental health needs.
At Oak Tree Health, we focus on value care. So we want to do focusing on your entire body. Every patient that I have met with so far has absolutely loved it. They have loved the fact that they get to come to Oak Street and they have everything here. And it takes a lot of the stress off of them.
I was feeling kind of low one day, and she asked me what was wrong. Would you be interested in seeing a therapist? I've been moving up ever since. I have a little choir, and I get out more. I've gone back to church. She has made me see a lot of things that is not over yet.
Over the last few years, Aetna teams have been working to streamline credentialing processes, making it easier for small businesses to join our network. Over 150,000 new providers have joined the network just in the last couple of years.
Our experience with Aetna has been excellent. Their clinical teams consistently display their focus on improving the lives of their members, and that aligns with our mission for our patients. As an example, we're working with Aetna on a project that would create specialized access for a certain elderly patient group.
Access to care has been the predominant problem that we've been dealing with over the past few years in behavioral health as an industry. A fast follow-on to that is, once you get somebody into treatment, how do you make sure that that person is getting very good, high-quality, evidence-based care? And so really that's where we've been spending a lot of our time and energy.
We partner with our large providers and have created shared clinical reviews. We take a look at clinical charts and data, and together create benchmarks and shared goals, building a better practice for our members. Aetna is the health insurance plan. We've been working really hard so that your patients then also have access to all the services that they need.
We're at the point to where not only can we deliver the services that they need to have the best health outcomes overall, but from a data and analytics perspective, we're getting good enough to prove it, to demonstrate out how much does that behavioral health intervention actually help. It's really allowing us to tailor the interventions that we make available to people in a way that we couldn't before, and I'm very excited about the work that's happening right now.
We're really on this journey of making sure we're meeting the needs of and the demand that's out there. It's not just access to therapy, it's access to care. And we really see ourselves as a key part of that ecosystem. So we expand care delivery in general.
Thanks for watching, but now an important disclaimer. The content of this video is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Viewers should not disregard or delay in obtaining medical advice for any medical condition they may have and should seek the assistance of their healthcare professionals for any such conditions.